Well, welcome, and I'm really happy to have you here today, and I'm grateful to Nick for recording this. I said I want you to record it so that I don't ever have to do it again, because it's not one of my favorite things like everybody else. But I want to start by just talking about what is going on with this pain epidemic, right? There's so many people who are in so much chronic pain, and there are so many people who are taking really excessive amounts of medication, and then people who need the medication, but then they are also now being kind of left in the dries, which is another whole set of problems. So I thought maybe if people understood a little bit more about why they have pain, then that would be something that would be really beneficial. Anyway, so understanding the nature of pain, I think, is a really great key to having some permanent comfort. So to get you on the right path and to start you feeling better every day, I think it's ideal to use people and therapies and technologies that understand the nature of your pain. So for me, I've worked in healthcare for about 30 years, and I loved acute care. I loved working at the hospital. I loved ICU. I loved so many different parts of that job. I really enjoyed it. But I saw that there was a space here for chronic people coming in over and over and over again. We'd tweak their medications. We'd try to do this, try to do that. But really some chronic illness and chronic pain, and not very many really safe tools. So my first motto is to do no harm. I am huge on that. So sometimes in working up at the hospital, you'd have interventions, you have something that requires you make a small incision, solve a big problem. But in the world of chronic pain and chronic illness, there was not very many that would really do no harm. So for me, I just wanted to let that whole piece go. I didn't want to risk it anymore. Sometimes it came out good, sometimes it didn't come out so good, and I just personally didn't want to take that risk anymore. So I looked for non-invasive, non-harmful therapies that can create a healthy, healing environment. So I think there's some wisdom that goes just maybe after being around the block a lot. And that comes from experience, and that knowledge comes from knowing what, when, and most important, why your body's doing what it's doing, why you're experiencing what you're experiencing. So for me, I grew up in a situation where my dad was in hospital administration. We had tons of friends who were physicians, and I also had a mother who was raised in a really natural environment. And I just really am passionate also about healthcare without fences, because I think it's more important to focus on why you need something and not what I know or what I've been taught or what I bought into or what someone told me. You know, there's just this place where people would look at that and they'd see a boundary, and I'm looking straight through on the other side. For me personally, I would have died twice at pretty young ages without Western medicine. But without natural medicine, I would have had continuously failing health and possible couple fatalities without natural medicine and therapies, because the Western side of that would have not, either there wasn't anything for them to do, or it would have been more harmful than my body could tolerate. So I look at this and I'm so grateful to have experienced both sides of that fence. So a lot of times people get frustrated in the world of chronic illness. Take a pill, get over it. Let's go shopping, let's go play. And that's fine if it's the right pill, right? So if there's a good intervention and it's the right medication, then I'm all for it. But sometimes it's just masking the symptoms, and that'll get you through the day. But sometimes that can also deepen the problem. I love this lady with the mask. She's like, yeah, I'm okay. It's all right. I'm working, really. So therapies that don't address the problem are like driving a flat tire without actually fixing the leak. So the first thing, when I think of pain from injuries, right? That's the most quick thing. What did you do? When did this happen, right? Did you fall and XYZ? So did you fall, break, bruise, cut, tear, something? And in that situation, acute care is phenomenal for surgeries, for casts, for braces. Ice and heat are great. Physical therapy, chiropractic, alignment therapies. Those are all great places for those type of injuries. You can also accelerate the way that you heal by using a lot of other modalities. In the world of chronic pain, years after an injury, right? so many people who are in their, maybe that 50s and 60s, where if you didn't heal in that 60 to 90 days, it kind of becomes a habit. And the older we are, the fewer stem cells, the fewer rejuvenating capabilities we have. And it's like, I guess that's going to hurt, you know, forever now. So it's nice to know that there's some tools out there that can help with this. Even working with cell memory, muscle memory, nerve memory, hormone memory, and some PTSD, because sometimes I think that people who have experienced chronic pain, you look at Costco on the concrete floors and you think, I'd really like to go, but I'm having anxiety about going just because I'm going to have to walk through and I'm going to be in so much. How much pain am I willing to put myself through in order to go to that activity? So there's a lot of anxiety that goes with just having the pain. So when it comes to reprogramming memories, stem cells is a great way, a great asset. Daily therapies. So if you can do one little thing every single day to keep rejuvenating. I'm going to eat some antioxidants. I'm going to eat some anti-inflammatory foods. I'm having a mind-body therapy, which is things like biofeedback, so many different technologies, body code, emotion code. Massage can be phenomenal for reprogramming. Things that Phil does is great for reprogramming, where you let go of those old patterns and bring in new patterns. So reprogramming cell memory is not something we think of in healthcare, but it is something that in the world of natural medicine, you actually have a lot of different options there. So ischemic pain is another one that we don't often think about. If you've lost your blood or oxygen supply, like with angina or heart pain, or migraines or strokes, or peripheral neuropathy, right? Raynaud's, Berger's disease, where you have poor circulation. So you have to look at it in stages. First of all, you have lungs that bring in oxygen, right? So if your lungs aren't working, right, airway, breathing, circulation. So if you have airway and you have proper lungs to bring in oxygen, that's the first thing. And then you have to have some healthy red blood cells for that oxygen to attach to. And then you have to have piping, right? We need arteries and veins and capillaries that will circulate those red blood cells where they can release the oxygen, and that's the tissue that we need. So anywhere along those stages, you can have a challenge that will cause you to have ischemic pain. Now, if you have ischemic pain and you're not doing something to address the ischemia, then you're going to continue to have pain. In other words, you could take an aspirin, it'll thin your blood, make it a little easier for your heart to pump, and that also has some analgesic effects. But did you deal with your airway, your lungs, your blood, and the integrity of it, and then also your circulation? Not really, but you got a little pain relief. So over time, that's not going to resolve the underlying issue. So when you look at doing a blood detox, healthy red foods is great. Deep breathing, saunas, steam, exercise or exercise therapies. Obviously, my favorite exercise therapy is EECP. So if you can get 3 years of exercise done in 35 hours, that's a good thing. I'm all about the shortcuts. I call them health hacks, but that doesn't sound quite right. But yes, in other words, in a way that your heart can receive the reconditioning that it needs, your circulatory system can get a huge boost from doing something like EECP. So you want to also work on cleaning and opening those arteries and veins. Sometimes there's medications. So in the case of angina, nitroglycerin. I had a client who would take nitroglycerin, and he had really progressed heart disease, and he would take the nitro and then he'd force himself to go work out. He was also the reason why we have EECP here. So he realized that if he could take pain medications, but really he needed to treat the ischemia the way that properly with medication and with good therapies. Light therapies can help clean this up as well. And then electrical stim for angiogenesis, like the H-wave, an E-stim. There's a lot of different ways that you can stimulate your growth of arteries and veins, which is what the angiogenesis is. Infection pain is something that people don't often think about in terms of pain. I want to say it's my favorite, but it sounds gross. I'm intrigued the most by infections. Immunology is a fascinating topic in my own research and in my own desires to help people on that path. And infection pain has been just really a piece where I have to figure out the why a lot of times. So, and especially even if you had an injury, that weak tissue becomes susceptible, and there's opportunistic infections that'll settle in that weakened tissue. So something as simple as a sore throat, right? Strep, you do a quick strep, take your antibiotics, in 48 hours, your sore throat is gone, bam. That's a proper medical treatment for a severe case of strep. But then we have like shingles. I was reading the other day that they're now saying that there could be as many as 5 different kinds of shingles, and only one of those will give you a rash. So you could have a nerve infection in any nerve in your body, anywhere in your body could have shingles and cause that chronic nerve pain. Again, if you didn't identify it as shingles and get the acyclovir right away, then you're dealing with that 60 to 90 days. And if it's after that, it's very difficult to have any type of a treatment there. So working with things that boost your immune system are huge. Headaches, several people who have had different types of a blunt injury, a concussion, or a headache that's been going on for years, and Nocardia is a particular type of bacteria that can continuously cause that type of a headache, and usually within the nervous system. So also then we have stomach aches, right? The Peptostreptococcus, H. pylori, these are all different types of infection pain. And then do some immune boosting and some balancing. There's a lot of different ways that you can do that. And healthy digestion is huge. So a huge part of our immune system is held in the lymph in your gut. And if you don't have the proper pH balance, if you don't have the proper probiotic, prebiotic regimen, if you're not taking good care of your digestive tract, then you probably will not have a healthy immune system, or at least not for long. And that's a really great place to rebuild. Mind-body therapies, again, is a great place to start boosting your immune system and to create emotional and physical resistance. So having that ability to say, you know, there's people who, they're like, I never get sick. I don't have time for a cold. Well, there's some wisdom to that. You are resistant. You're like, I mean, I worked at 10 years up on PEDS and in other places surrounded by infectious disease. And I'm like, this is not my world. I am not getting sick. I just don't have time. So, and purposefully using things and utilizing things in my own life that if you knew that you were exposed, then you would have a kind of a tool chest of things that you could do to make sure that you stay resistant. Lymph massage is another really great way to keep your immune system healthy. And working with Sally, who's fantastic, right back here. Great at doing lymph massage because that's your transportation system for your immune system. So it's blocked up, it's going to be more susceptible for infections. If it's moving and it's clear and it's able to get those underlying pathogens out of their system, then you're going to have so much more success. Toxic pain is one that we don't think about very often. Toxic pain comes from a lot of different resources. Chemical burns can be excessive medications or not well metabolized medications. So that might be a proper dose for somebody, but for this person, if they have an unhealthy liver, which the physician may or may not have known about. So if they don't have a way to metabolize that, then it could build up really quickly. So it may be a healthy dose, but not for that person. And then radiation, of course, insecticides, asbestos, toxic foods, our cosmetics. All of these are sources of toxins, and they can eventually build up and cause pain. So obviously, we need to detox, but do it carefully, please. Be careful. So number one, avoid exposure. If you don't have to eat toxic food, please pass. Skip it. If you don't have to surround yourself with cosmetic materials that are toxic, you have choices now. It's so great because we really do have a lot of different options. Hydration is essential. And then neutralize it if it's possible. Alkaline foods will help offset the toxicity that can come from toxic pain, and then use those detoxing therapies and products, but use them carefully. So if you detox a liver on somebody, on yourself, and you have been constipated for the last 10 years, you are not going to have a successful liver detox because it doesn't have a transportation system to get out. So you have to start with an exit strategy and good hydration, and then you can move deeper and deeper organs and deeper tissues so that you can detox properly. This is where a lot of people in natural medicine, I feel like, take matters into their own hands. They go too deep. They're like, yeah, I'm going to cleanse my blood. I'm going to cleanse my liver. I'm going to cleanse my kidneys. And they didn't work with somebody who understood how to walk them through that process. So inflammation from allergies is a source of discomfort and pain. Literally unlimited number of possibilities that you could have an allergic reaction to. So I've seen people allergic to B vitamins. We had one lady who was allergic to nickel. So nickel is naturally occurring in almost every healthy food. She said, if I eat at McDonald's, I feel fantastic. If I eat a salad, I feel terrible. So I'm like, well, that's not okay, because she was obviously becoming more and more nutrient deprived, but she was also full of histamines every time she tried to eat healthy food. So working with Nate Therapy, he's probably in with somebody, isn't he? So Dr. Fife does an allergy elimination treatment that is phenomenal. And we can also work with homeopathics, the mind-body therapies, doing biofeedback, a couple of different ways you can scan to find out what you are allergic to. Pull those big weeds first, the big issues first, and then you can start whittling down into more and more. You can be exposed to animals. Everybody has cats and dogs that different people can be allergic to, environmental exposures, and your own dead cells within the body. So if your body's not regenerating properly, even the die-off produces a histamine response, and you can become allergic to that. So the allergy symptoms, yes, pain. I had one client who was dealing with some knee pain, and it was, we'll try the Enlights, let's try the H-wave, let's try all these different modalities as far as dealing with his localized knee pain. But on one of the scans, gluten came back as this allergen for him, and finally he's like, fine, I'll give up the gluten. And after about 10 days, no knee pain. And his physical therapist was like, you're gonna need to have those knees replaced. This is an ongoing thing. That's where you're heading. Not anymore. So the allergies can affect all different types of your body. They can cause headaches. They can cause just plain old fatigue. You eat it and you just feel tired and worn out and had it. So, and then true pain. So you never know what an inflammatory response can cause in terms of pain. So resolving those allergies, of course, you want to identify and then avoid and reduce those histamines. You can do a lot of that by having an antihistamine-based diet. Reset those reactions with Nate and other technologies, and then resolve the emotions attached to it. When I talk about emotional and spiritual pain, this is something that not a lot of people talk about, especially in healthcare, in our traditional model, but I don't think there's anybody who hasn't experienced it, right? We've all had those days where the grief was too much, the loss was too much, the toxic relationships were too much, the negativity, blaming other people, not setting healthy boundaries for yourself, that fear and anger that can be directed outwards, but it can also be directed inwards, and that's what depression is. And so I don't know anybody who's not experienced this, and also anybody who's experienced this doesn't have some also physical pain. But if you're going to have a resolution to it, you have to do you got to do some deep work. You need to look at those spiritual habits and exercises that can reconnect you to that part of yourself. Now, some people base that on religious practices. It can be, but it doesn't have to be. Being spiritual and being emotional is part of being human. It's part of who we are. So setting healthy boundaries on relationships can be also really beneficial. Listen to the way that you talk to yourself. Our world is very noisy. And if you are not having healthy conversations in your own mind, if you're arguing, right, that's not healthy. So having that positive self-talk and training yourself, just like you exercise other things, you have to train yourself to talk to yourself correctly. And then having trusted friends or therapists can be a huge asset. Mind-body therapies can be fantastic, like the biofeedback. That's my personal favorite. Body Code and Emotion Code with CJ Puotinen, and EFT is a great place to deal with this as well. So she has a whole nother toolbox dealing with these ways to heal within. Really what is based on is your body has the ability to heal itself. We just need to get all these other issues out of the way. And Body Code, Emotion Code is one of those great ways to do that. Again, gut health, when you're looking at emotions, I cannot tell you how many times somebody will come in, they're like, I'm just tired and I'm just depressed, I've had it. You know, they're just kind of at the end of their emotional rope, but parasites or a fungus infection or something huge going on with their gut, which is soaking up all that serotonin that's produced. 85% of that is in your digestive tract, but it affects their mind and it affects how we feel emotionally. So a lot of times there's a physical component to what we're experiencing here. Also with the emotion part of it, mood swings, anxiety, depression, all of these are also signs of brain injury. So a lot of people talk about NAMI and they talk about mental health and how critical it is, and it is. But if you don't have a healthy brain, you will not be able to restore your mind. Metabolic pain. You can have too much, too little. I know people that OD here. I know people that OD here. It's hard to imagine that you would have too little of these types of foods, but I actually did one time have someone who was so obsessive about eating absolutely everything just right. I actually said, just find a healthy, non-GMO organic burger. Please go, I actually told him to go eat a cheeseburger just for variety in his diet because he had a very restricted diet and it really was becoming a metabolic problem. And so you can have too much or too little of anything. You can have too much water. You can have too much vitamin D. You can have too much. So make sure and be careful. There's also metabolic errors, and this brings us to mitochondrial dysfunction. Mitochondrial dysfunction is not a very common piece, but is very difficult to diagnose. This has to do with the Krebs cycle and the way that every little powerhouse in the cells work. Now, the crazy part about mitochondrial issues is that the symptoms vary day by day. They can be miserable in a different part of their body, in a different system. It's very unpredictable. So there was a gal that taught me a lot about this. She had a genetic mitochondrial disease, and we worked on the genetic piece using the biofeedback. We worked on balancing a lot of different aspects of her life. She really perfected nutrition. On her own level. She really worked on that. Very clean. She was very susceptible to toxins. So if you wanted to know if something was toxic, she could tell you very quickly. Did a lot of immune boosting, and hyperbaric actually was a great treatment for her to the extent where she finally bought her own. So for mitochondrial dysfunctions, that's a really great thing. So when you look at localized pain, you want to make sure that you search for the underlying culprit. This is one of my favorite stories about knee pain. I was in Mexico, we were with some friends, and I woke up one morning and my knee started hurting. And it was like 30 years old. I didn't have knee pain. And I thought, what in the world is going on? Well, that day I had scheduled, they had one of the top 10 spas in the whole world, and I had scheduled a therapy that day, and she was an acupressurist as well. And she says, there's something I can do for you? And I said, my knee hurts today. It's killing me. It's really uncomfortable. And so she went over and she worked it and she goes, oh, that's your gallbladder. What'd you eat yesterday? I said, crab and butter. And so she just did some simple acupressure work on that gallbladder meridian. I ate some fruits and veggies. Everything cleared up and my knee pain went away, but it was my gallbladder. So working with a lot of different modalities can provide you with a lot of different solutions. We had one person that had some abdominal pain and abdominal tightness, diaphragm tightness, and I actually sent her over to Phil, and he was like, there's more here going on. He did a lot of great work with her, and he brought another therapist in even to work with him. They worked on it at the same time, and finally was able to get some relief and create some shifts there. So again, it's not about what I know, it's about what you need. And even when you're working with practitioners who understand that, you're going to have a lot more success. A lot of low back pain. blocked emotion, right, CJ? It's like, oh my gosh, the spine and blocked emotions is a big deal. And then you also get into those unresolved injuries. So sometimes when you have an injury that didn't heal correctly, you didn't let it rehab, then you end up having to go back and rework that area. So as a human race, we desire for things to be different. Like, we can always see the way the world we want it to be, the way we want it to be. But the number one human emotion is resistance to change. So we want to keep everything the way it is. We want to keep our beliefs. We want to keep our same habits. We want to keep eating the same crappy food. But can't you make that feel better? Could you make that feel better? I want different results. So one thing that I've learned from a lot of different clients who have been, they've been through a lot. And I just have learned not to quit. That's not my job. They'll say, well, what do you think? I should try this therapy, or should I go see this person, or should we try something different? Yes, but it's never my job to say, I don't think that anything is going to work for you. Because when you work with technologies and you work with creating a healthy environment, the body will find a way to heal. It's about removing the toxins, removing the pathogens, removing the old injuries, removing the cell habits, removing all of those things. Eventually you create a space, right? We create a space where things can heal. So again, it's not about what I know or my staff, or it's not about what any one type of medicine even knows. It's all about what you need. And then the lifestyle changes are up to you. I had one client who came in, we did a couple of different technologies and sessions, and he's like, that thing you do does not work. And I said, well, tell me what's going on. So he had done a couple and had really great results, but everything went back to the gut. And I says, what did you eat yesterday? Oh my gosh, literally just from a gas station, from breakfast, and not the good gas station food. There is actually some decent options now, but he ate like a breakfast burrito, coffee, donut, and then had corn dog and soda for the afternoon, and ate a huge steak and a half a case of beer for dinner, and wondered why my technologies do not work. I can't fix that. Sometimes I tell people I can't fix stupid. I try, but I try to educate them so we can not do that. So moving forward, it actually can be really easy. I've become really compassionate, and I'm very obsessive and passionate about finding ways that are right for that person and creating this space where we use technologies that listen and create that shift to allow this space for new patterns, new habits, and then you finally have some relief. So how do you move forward, right? Try one new thing. Try one new thing, maybe even every day if you're really uncomfortable. So try a new food, try a new technology, try a new therapy. Try something new every day until you've created enough healthy space that your body no longer needs to be uncomfortable anymore. So thank you for coming.